As a practice nurse, we cover chronic disease management, contraception reviews, women's health, cervical smears, baby immunisations, travel clinics, lots of different things that are jam-packed to keep the patients well. I most enjoy looking after the patients, keeping them well, so educating them so they can take some responsibility of their own health. We also do a lot of education in our practice, so it's educating the next generation really to look after these patients, and seeing a patient that is unwell and we've managed to get their chronic disease management under control, I think is the main thing, because you know that they're then going to sort of go on in the future to be able to look after themselves as best they can. I qualified 19 years ago, and as a newly qualified, I did go and work in secondary care. I spent 11 years working on the medical admissions unit in a local hospital. About 8 years ago, I decided to move to primary care because I just felt that this was where I would be better suited with my skills. The transferable skills were very different, so it was a lot of education in primary care, and I just love the fact that we can obviously look after these patients. The education in primary care is fantastic. Since being in primary care in this practice I'm in now for the last 3 years, I've completed an extra degree and 2 diplomas, so the educational opportunities are absolutely fantastic. Be prepared for lots of surprises. Primary care can take you in many different opportunities for job careers. Patients will often come into us and we can see lots of generations from the same family, which is great. You're looking after your patient and you're trying to educate them to keep themselves well, rather than looking after them when they're poorly, when they're in hospital. So a lot of it is about chronic disease education and management, and also training other members of staff as well, because these are our generation, or our future, aren't they? So it is about passing on your skills and transferring the education that you have to them. There's lots of different career paths in primary care and lots of different education, and there's lots of support out there. Your general practice will assist you as well, because they want you to do as much as you can in their practice and your field. There's also other forms of education in primary care. The GP forums are fantastic as well at getting the information across, and the local health board will offer as many opportunities as they can. You can go into specialist nursing, you can do your independent prescribing at the local university. It's about making the most of your opportunity, isn't it? And being able to look after these individuals to your best of your ability. You often look after many generations of the same family, so it's about passing that information on to them and trying to educate them as best you can. It's about passing on a passion for excellent nursing, teaching our students and mentoring to the best that we can. You can also initiate improvement projects in the GP practice. Most recently, we've initiated a drop-in smear clinic in the surgery that I work in. We started off a trial and the uptake of it was fantastic. So it's now something that we do for 2 evenings a month, and the ladies are still coming in to have that cytology taken, which is fantastic.